There have long been big differences in health across race, income, education, and geographic location. These differences are even worse in our state and our region. In the early 2000s, a group of researchers at UAB saw things differently, that there was more to health than biology and personal choices, a notion that would be made apparent on a bus ride through the Mississippi Delta.
Mona and I had received a grant from the National Cancer Institute to address disparities in breast and cervical cancer in the Black Belt of Alabama and the Delta of Mississippi. And we were struck by the poverty levels, the distances between healthcare services.
We felt like, how are we going to tell a woman, go and get a mammogram? Is this a priority? She lives in poverty. She doesn't have transportation. But also she may have other conditions in addition to getting a mammogram. For us just to go and tell her, leave everything and find the transportation to get a mammogram, I felt like this is unethical.
What became clear was the need for a comprehensive approach to understand the science of health disparities and the recognition that where a person lives, the condition of their neighborhood, and their access to health, education, and economic opportunities were vitally important to health. To address such disparities, we needed to learn more. The UAB Minority Health and Health Disparities Research Center was established to conduct research and develop the partnerships needed to eliminate health inequities. And Alabama was the perfect setting.
The origins of the MHRC were really tied to people who'd had a commitment to dealing with the obvious healthcare disparities that existed in our area. And we lived in, if you would, the heart of many challenged communities. And there was a sincere understanding that leaders would have to be transparent, committed, and engaging with those communities to build trust.
If the problem is in the community, the solution is in the community.
This innovative approach caught the eye of the National Institute on Minority Health and Health Disparities. Shortly after, the MHRC received the first Centers of Excellence grant in what would become 20 years of continuous NIH funding to study and mitigate health disparities.
It solidified the role of the center both in the culture of UAB, the state, the Deep South, and arguably the country.
For 2 decades, the MHRC has been at the forefront of minority health and health disparities research nationwide, generating over $165 million from NIH and CDC-funded projects in Alabama, Mississippi, and Louisiana. The MHRC has also helped break new ground in health disparities research, providing nearly $7 million in funding to 146 scientists for innovative pilot projects. The kind of discovery and change MHRC researchers bring to underserved communities is priceless. As such, the thoughtful development of training and education programs for future generations is critical in the continued success of the MHRC.
We wanted the patients and the populations and people in the community can see people that look like them, that they're addressing their issues and challenges. And that's when we focused on our training program with partnerships with historically black colleges to attract those undergraduate students and equip them with the knowledge and with the training so they can be competitive to get in health sciences.
While research and training is a big part of what we do at the MHRC, the community is at the heart of it. They are why we do it.
We move at the speed of trust. We really work on establishing and maintaining relationships. It is a series of going back and being there, being available, picking up the phone and calling just to check in. It really is not magic that we've been able to identify such wonderful partners, but it's that we have had these relationships for perhaps 2 to 5 years, and we've been there. The MHRC has been there and has always been there.
The MHRC has been remarkable, but we're not done.
The further maturation of the Minority Health and Research Center has been one from moving from disparities to health equity. But also, I think Live Health Smart is really also the further defining of the MHRC to really step out and lead and collaborate to impact our entire state.
As the UAB Minority Health and Health Equity Research Center looks to the future, we will take key learnings from the past 20 years and turn them into practical efforts to achieve health equity. As the MHRC embarks on our next phase, we and our community partners will work together to ensure that a person's address and circumstances don't determine their ability to live a healthy, productive life. The UAB Minority Health and Health Equity Research Center, making health equity a reality.